Assalamu alaikum. This is Dr. Lubna from Anatomy Department, PGMI AMC. And in today's class, we're going to learn about the triangles of the neck and the different muscles making up the boundaries of these triangles, as well as the contents of all these triangles in a prosected specimen. So, to begin with, we're gonna have a look at the division of the triangles of the neck, in which the anterior triangle is being divided into carotid, submandibular, submental and muscular triangles, and the posterior triangles has been divided into two triangles, the supraclavicular and the occipital. Now here you can see that the cadaver has been painted to demonstrate clearly about the boundaries of the different triangles and the subdivisions of the anterior triangle. Okay, now the anterior triangle has three boundaries: the midline, which runs all the way from the chin to the suprasternal notch. This portion is the inferior border of the mandible, right? And the third border is the anterior border of the sternocleidomastoid muscle. So all these three boundaries make up the anterior triangle of the neck. So the base of the anterior triangle is inferior border of the mandible, and the apex is formed at the suprasternal notch. Alright, now to begin with, we have submental triangles, submandibular triangle, the green one, we have carotid triangle, the red one, and we have this muscular triangle, the yellow one. Okay, so these four triangles make up the anterior triangle. Out of these, both the submandibular and the carotid are of great clinical significance because of very important structures present here. Okay, this is the hyoid bone. So the level or the location of the hyoid bone in the neck. This represents the superior belly of omohyoid. This is the lower half of anterior border of sternocleidomastoid muscle, and the third boundary is formed by the midline. So this yellow triangle represents the muscular triangle of the neck. Second is the carotid triangle, the boundaries of which are formed by superior belly of omohyoid, posterior belly of digastric, and upper half of anterior border of sternocleidomastoid muscle. So this is the apex, and the lower portion, this portion makes the base of the triangle. Okay, now the third triangle is the submandibular triangle, the boundaries of which are formed by the inferior border of the mandible, posterior belly of digastric, and anterior belly of digastric. This is also called the submandibular region or the digastric region because of the presence of submandibular gland here. Okay. So the next triangle, which has been painted blue, is the submental triangle, which is located right beneath the chin. The one of the boundary is formed by the anterior belly of digastric, the midline, and the hyoid bone. This is the submental triangle because of location below the menton. Okay, now we would like to have a look at the posterior triangle now, the boundaries of which are formed by the posterior border of the sternocleidomastoid, the middle third of clavicle, and the anterior border of the trapezius muscle. So the three boundaries are formed this way. Now the base of the triangle is clavicle, and the apex is formed here. Okay, this is the posterior triangle. It is subdivided into two triangles by inferior belly of omohyoid. So this small triangle which is formed is the supraclavicular triangle. The boundaries are formed by inferior belly of omohyoid, posterior border of the sternocleidomastoid, and clavicle. Right? This is the supraclavicular triangle. And here is the occipital triangle, the boundaries of which are formed by posterior border of sternocleidomastoid, anterior border of trapezius, and below by the clavicle. So this finishes the boundaries of the triangles. Now here we want to look at a prosected specimen in which we would like to show you the different structures present in different triangles. So we would reflect the skin. Here is the platysma, and we would reflect the platysma muscle upwards to reveal all the important structures behind. Okay. So the first structure that is shown here is the sternocleidomastoid muscle, which divides this region into an anterior triangle and behind by the posterior triangle. Right? This is the posterior triangle. So this is the midline, this is the inferior border of the mandible, and this is the anterior boundary of sternocleidomastoid. So this is the base of the triangle, and this forms the apex of the triangle. Now we would like to reflect the sternocleidomastoid muscle to show more and more structures behind. Okay, here is the muscular triangle, submental triangle. We have the submandibular triangle where you can clearly see the submandibular gland, right, as well as the carotid triangle. So this is the first muscle that we're showing is the anterior belly of digastric muscle. Let us talk about the boundaries of the submandibular triangle. So the first boundary is formed by the posterior belly of digastric, and we already showed you the anterior belly of digastric and the inferior border of the mandible. The three boundaries of this triangle are formed this way. This is the digastric muscle with an intermediate tendon which is attached with the help of a fascial loop to the hyoid bone. This is the anterior belly of digastric, and here is the inferior border of the mandible. So this forms the base of the triangle, inferior border of the mandible, and the apex is formed where the anterior posterior bellies meet. This is the submandibular gland. This is the facial artery which is going towards the face, and behind it is this structure that you see is facial vein. So both these structures lie side by side, and they are identified by their location of entrance into the face. Right? Okay, now this is another very important structure, the hypoglossal nerve, and we identify it because it goes from posterior to anterior aspect and passes in between the mylohyoid and the hyoglossus muscle to enter the oral cavity. Now here you can see that it is clearly identified here because it moves on along with the posterior belly of the digastric muscle. Now, here you can see this is the hypoglossal nerve, which is the motor nerve supplied to the tongue. And this is the posterior belly of digastric muscle. So both these structures run side by side. Okay. Now next, to the submandibular gland, to the submandibular triangle, we're going to have a look at the second most important triangle, which is the carotid triangle. The boundary is formed by the superior belly of omohyoid. This is omohyoid muscle. You see, this is the ribbon-like strap muscle of the neck. This is superior belly of omohyoid, which is making up the boundary of the carotid triangle. The anterior border of the sternocleidomastoid muscle makes up the second boundary, and the third boundary is formed by the posterior belly of the digastric. This is the apex of this triangle, and the base is formed by the posterior belly of the digastric. So these three boundaries make up the carotid triangle. Now very important structures are present in this carotid triangle, and we're going to show them to you one by one. Okay. Now the first structure that you see here is the common carotid artery. Okay. We reflect this sternocleidomastoid muscle to reveal more structures in here. Now I would like you to have a look at this structure, which is the internal jugular vein. It lies lateral to the common carotid artery, and anteromedial to it is this important structure, which is the common carotid artery. Okay, the common carotid artery divides at the level of upper border of thyroid cartilage into an external carotid artery and an internal carotid artery. This is the external carotid artery. The anteromedial artery is the external carotid artery, and the posterolateral one is the internal carotid artery, which is going to supply blood to the brain as well as the eye, while the external carotid artery runs to supply blood to the face region. Okay. The third structure that we see here, this is the vagus nerve in between the internal jugular vein and the common carotid artery, which is the 10th cranial nerve. These three structures, the internal jugular vein, the common carotid artery, and the vagus nerve, they are unsheathed in the carotid sheath of the cervical fascia, cervical deep fascia of the neck. So here you can see another important structure. This is ansa cervicalis. In front of the internal jugular vein is ansa cervicalis. Ansa means loop. This loop is formed by a superior root from C1 spinal nerve and inferior root from C2 and C3 to form a loop or ansa in front of the internal jugular vein, and this is there to supply the nerve supply to the strap muscles of the neck. This is the inferior root and the superior root. They join together to form this nerve, and here you can see it is divided into a few branches to give nerve supply to the strap muscles of the neck. Okay, so these are the important structures of the carotid triangle. Okay, now here we can see the branches of the external carotid artery. This is the external carotid artery. The first branch is the superior thyroid artery. This is the superior thyroid artery, and you can see that this is the second branch, the lingual artery. And this here you can see a branch of the vagus nerve, internal laryngeal nerve, which is coming from the superior laryngeal branch of the vagus nerve, and this nerve is going to pierce the thyroid membrane and going inside the larynx to innervate the mucous membranes inside the larynx above the true vocal cords. The internal laryngeal nerve, along with the internal laryngeal artery, which is a branch of the superior thyroid artery, also goes on to pierce the thyroid membrane, but it is not seen here. The internal laryngeal artery is not seen here. So this is the internal laryngeal nerve, branch of the vagus nerve going inside the larynx. Okay, now if we move this aside, we can see another important structure here along the vertebral column on both sides is the cervical sympathetic trunk. We cannot see the superior, middle or inferior ganglia here, but the location is typical of the cervical sympathetic trunk here. Okay. Now, moving on, the next structure that we're going to see, this is the hypoglossal nerve that we already talked about. It runs in front of the external carotid artery and alongside the posterior belly of the digastric muscle. So this is the hypoglossal nerve. Okay, this is the external carotid and the internal carotid. You can see that lies posterolateral to this. Okay, these are the structures of the carotid triangle. Now we're gonna move on to the next triangle, which is the submental triangle. The anterior belly of digastric muscle makes up one boundary. This is the anterior belly of digastric. This is the hyoid bone, and here is the midline. So these three boundaries make up the submental triangle. This is the chin. So the floor of this triangle is made up by the mylohyoid muscle. This is the mylohyoid muscle which makes up the floor of the oral cavity as well as the floor of the submental triangle. Submental lymph nodes are also present here, which drain the lower lip as well as the tip of the tongue. In CA or carcinoma of the tip of the tongue, the submental nodes are very important diagnostic tool to diagnose the carcinoma of the tip of the tongue. Okay, this is the submental triangle. Now coming over to the muscular triangle of the neck, the fourth subdivision, the boundaries are formed by the midline, the superior belly of omohyoid, and the lower half of the anterior border of sternocleidomastoid muscle. Right? The boundaries are formed like this. This is the apex of the triangle. This is the base of the triangle. Now the muscles that we see here are, the first muscle that you see here is the sternohyoid muscle. This is the sternohyoid muscle that runs from sternum below to the hyoid bone above. The second muscle that we see here, this is sternothyroid, which is inserted into the oblique line of the thyroid cartilage. This third portion, small portion that you see, is thyrohyoid muscle. Okay, and the fourth one is obviously omohyoid. So these are the strap muscles of the neck, which are ribbon-like muscles. This is the nerve supply which is coming from ansa cervicalis of the cervical plexus going into the cervical strap muscles. Okay, these are the four triangles. Now this is platysma. We would reflect the platysma, and then we would like to show you the contents of the posterior triangle as well as the boundaries. This is the mastoid process. This is the suprasternal notch, and here we can see the sternocleidomastoid muscle. Behind the sternocleidomastoid muscle, we see the posterior triangle of the neck. This is the boundaries of the posterior triangle. Middle third of clavicle, the posterior border of the sternocleidomastoid muscle, and the anterior border of trapezius muscle. This is trapezius muscle. Okay, so these three boundaries make up the posterior triangle. Now this posterior triangle has been divided into two triangles by the inferior belly of omohyoid. I would just show you the inferior belly. Right now, this structure that we see in front of the sternocleidomastoid is the external jugular vein, right? It runs in front of the sternum or superficial to the sternocleidomastoid muscle. Okay, we would just reflect this sternocleidomastoid muscle to expose the omohyoid muscle here. Omohyoid muscle. This is the inferior belly of omohyoid. This is clavicle, which forms the base here. This is the inferior belly of omohyoid and formed by the posterior border of the sternocleidomastoid muscle. So the three boundaries make up the supraclavicular triangle, right? We can clearly see the boundaries of the supraclavicular triangle. Now coming over to the occipital triangle, here important structures are present, but first let us identify the muscles. The first one, this is scalenus anterior muscle. Okay, this is scalenus medius muscle. The muscle lying next to scalenus medius, this is levator scapulae. This muscle is levator scapulae, and behind is here, this is splenius capitis, which is going on to the back of the neck, splenius capitis. Okay, these muscles make up the floor of occipital triangle, all these muscles. Okay, now this important structure that we see in front of the scalenus anterior is the phrenic nerve, which is coming from C3, C4 and C5 roots, and we identified because of its location. It lies right anterior to the scalenus anterior muscle, and sometimes it is tethered to it with the help of fascia to the anterior surface of scalenus anterior muscle. Okay. Now in between the anterior scalenus muscle and the posterior scalenus muscle, middle scalenus muscle is the root of brachial plexus. The posterior scalenus is not seen here. It lies posterior to the middle scalenus muscle. This is the root of the brachial plexus, right? C5, C6, C7 roots. This scalenus medius muscle. Okay, now we would like to show you two other very important structures here. This is the right side of the body, and let us reflect the platysma to show you those two other structures. Okay, here